Imagine your body slowly turning into bone, piece by piece, until movement becomes impossible. This is the horrifying reality for those living with Fibrodysplasia Ossificans Progressiva, FOP, a rare and devastating genetic disorder. Also known as Stone Man syndrome, FOP progressively transforms soft tissues into bone, effectively imprisoning individuals within their own bodies. What is Fibrodysplasia Ossificans Progressiva? FOP is an extremely rare genetic condition, with approximately 800 confirmed cases worldwide. It is caused by a mutation in the ACVR1 gene, which is responsible for bone growth. In people with FOP, this mutation leads to the formation of bone in areas where it should not occur, such as muscles, tendons, and ligaments. This abnormal bone growth restricts movement and can lead to severe physical disability. The onset and progression. The first signs of FOP often appear in early childhood. One of the earliest and most distinctive indicators is the malformation of the big toes, which can be short, turned inward, or have an extra bone. As the child grows, flare-ups can occur spontaneously or after minor injuries, infections, or even routine medical procedures. These flare-ups result in painful swelling and the gradual ossification of soft tissues. Over time, the condition progresses, causing more and more joints to lock in place. Shoulders, neck, hips, and jaw are commonly affected, significantly reducing mobility. As more areas become immobilized, individuals face increasing difficulty with basic activities such as eating, speaking, and breathing. Living with FOP presents immense challenges. Simple activities like walking, reaching for objects, or even turning the head can become impossible. Patients often require wheelchairs and other assistive devices to maintain some degree of independence. The psychological impact of the disease is equally profound, as individuals cope with the knowledge that their condition will only worsen over time. Despite these challenges, many people with FOP lead fulfilling lives, pursuing education, careers, and hobbies within the constraints of their condition. The support of family, friends, and dedicated healthcare providers plays a crucial role in helping them navigate daily life. Current treatments and research. There is currently no cure for FOP. Treatment focuses on managing symptoms and improving the quality of life for patients. Physicians often use anti-inflammatory medications to manage pain and swelling during flare-ups. Physical therapy is generally avoided as it can trigger further bone growth. However, there is hope on the horizon. Researchers are actively studying the genetic and molecular mechanisms underlying FOP, aiming to develop targeted therapies. In recent years, significant progress has been made in understanding the ACVR1 mutation and its effects on bone formation. Clinical trials are underway to test potential treatments that could halt or slow the progression of the disease. Raising awareness and supporting research. Raising awareness about FOP is critical to supporting those affected by the condition and advancing research efforts. Organizations like the International FOP Association, IFOPA, work tirelessly to provide resources, support, and advocacy for individuals with FOP and their families. They also fund vital research initiatives aimed at finding a cure. Fibrodysplasia Ossificans Progressiva is a devastating condition that turns the body into a living prison. While there is currently no cure, ongoing research offers hope for the future. By raising awareness and supporting scientific advancements, we can help improve the lives of those affected by this rare and cruel disease. Understanding and empathy are the first steps in supporting those who endure the unimaginable. Together, we can work towards a future where the nightmare of FOP is finally laid to rest. Resources for further reading. International FOP Association, IFOPA, https://ifopa.org, National Organization for Rare Disorders, NORD, rareddiseases.org, Genetic and Rare Diseases Information Center, GARD, https Rare Diseases, info.nih.gov, Diseases 8112, Fibrodysplasia Ossificans Progressiva.